Good morning.
Good morning.
I'm Cheyenne. I'm a student nurse.
Okay.
Could I get your name and date of birth, please?
Yes, my name is Sue Smith. 7/14 of 70.
Perfect. I'll just check. Okay. All right. So I understand that you're having some nausea, vomiting, and some abdominal pain.
I am. Yes.
Okay. So today I have an order to place an NG tube in, and it's going to help with that.
Okay.
So it's going to help relieve some of that nausea feeling, maybe the pain, and just overall make you feel more comfortable.
Okay.
Before I get started, do you have any questions for me?
Not at the moment.
Okay. A few ways that you can cooperate throughout the procedure is at the beginning, you're going to be asked to have your head like this, and then you're going to switch down almost, and then have you take a couple sips of water.
Sure.
Okay?
Yeah.
All right. So another thing I would assess before getting into starting the procedure is assessing her mental status and just making sure that she's alert and capable to understand how this procedure is going to work. Okay, and you seem fairly competent in that, so I think we'll get started.
Okay, great.
Okay. All right, so I'm just going to wash my hands, provide privacy for her, and I'm just going to put some gloves on. And then if I could you please put that on?
Sure.
Just a towel to help protect from anything. It goes on.
Yeah, it's just getting stuck a little.
Okay, perfect. All right, so what I'm going to do first is I'm going to assess your nostrils, and I'm just going to see which one I would rather use to put the tube in.
Okay.
I'm looking for anything that could maybe be a sign not to use it, and they both look like they're intact. Is there a nostril that's giving you more trouble breathing out of than the other?
Not so much breathing, but this one is a little sore sometimes.
Okay,
I would
alrighty.
say.
Another thing I could do is occlude one side and have
Okay.
you breathe in and out.
Okay.
Okay, and then this side too. Did you have any trouble breathing at all with any
I think this one feels a little more clear.
Okay, so
Oh,
use
okay.
the left
Correct.
for the tube. Okay. Alrighty, sounds good. So the first thing we're gonna do is we're gonna measure the tube to see how far it is we're gonna place it in. So we're gonna start at the tip of your nose, go to your earlobe, and then from the earlobe down to your xiphoid.
Okay.
And that is 54. So I'm going to tape it just so it marks where it is I'm going to be stopping.
Okay.
Okay. And then after that, I'm going to place my syringe in here and place it in the basin. Okay. So before I get started, I just want to make sure that you don't have any further questions or concerns about anything.
I do that.
Okay. One last thing before we get started. If you at all during the procedure feel like you have to gag or cough, I ask you just to raise your hand, and then that'll signal me to stop inserting the tube, and then you'll have to just take a couple breaths and relax a little bit, and then take some sips of water,
Okay.
and that should help pass the tube.
Sure.
Okay?
Mhm.
Alrighty. So here we go. First thing we do is we lube the tube in water-soluble lubricant. Okay. All right, so I'm going to ask you to extend your neck back like that. Okay, so I'm going to go down along the floor of her nostril and go up. And if at any point inserting it, it's like meeting resistance, I would stop, I would withdraw the tube, lubricate it again, and then insert it into this one.
Okay.
Okay. But since I didn't meet resistance, I'm just going to keep going. So I'll extend the neck. Yep. So we'll go up like this, and then we're going to go down towards her ear. And then at this point, I'm going to ask my client to tilt her head forward, and then I'm going to give her this water right here.
Okay.
And have you take some sips of water.
Okay.
As I insert the tube. Okay. Alrighty, so if she were to at all experience any coughing or gagging again, I would have just had her stop, take some breaths, and continue with drinking water, and hopefully that'll help just kind of pass that tube along.
Okay.
Okay, so now that the tube is in, I'm going to ask my patient to open her mouth. Thank you. And this is just checking to see if the tube coiled at all, and I don't see any coiling, so that's a good sign.
Okay.
Alrighty, so next I am going to withdraw some gastric content from here.
Okay.
And then I'm going to place it in here so that I can check the pH with my pH strip checking. And I got 2, and that's good. You want the gastric content or the pH between 1 and 4.5.
Okay.
And then next I'm going to draw back 30 mils of air. And then at the same time that I insert that air, I'm going to be listening for a swishing sound
Okay.
right about here. Okay, so I did hear a swishing sound, and that indicates that the tube is in the right spot.
Okay.
So if I didn't hear that swishing sound or get the pH between 1 and 4.5, I'd have to actually repeat that procedure. I would have to insert the tube 2 more inches down and then do the air and the pH. And then best practice is also to get an x-ray done. So that's going to help as well with determining if this is in the right spot.
Okay.
Okay? All right. So now I am going to tape this to your nose. Will that stick?
I think so.
Okay, so we would secure that to her nose, and then we would then make sure that there's enough tube for her to move around. And we would actually tape that and safety pin it to the patient's shirt or gown. So we'll do that. And then next we are going to apply this to the suction. So first I'm going to attach it to some tubing, and this tubing is going to connect then to the suction that is on the wall. Okay? So then once that's connected,
I'll just hold it.
okay. All right, so then once we have it applied, now I'm just going to go through a few things that we would document. And we would document the patient tolerance, the pH, the coca of the drainage, maybe the size of the tube, which is a 14 French. We would document what Schneer we used, the patency of the tubing and the suction, name what kind of suction we use, which is low intermittent, and yeah, just a few things to document. Lastly, what I want to talk about is the blue pigtail. So this blue pigtail is a air vent, so it is going to help this tube from sticking to the stomach wall.
Okay.
Okay, and that is it.
Thank you.
Thank you.
Yep.